All right. Hello, everyone. Welcome. In this video, we will be speaking to Erika Lim about occupational therapy. Hi, Erika.
Hi.
So you all should have a copy of her bio. So I won't share those details, but in this video, Erika is going to tell us more about her background and why she chose this path and what that's all like. At the end, we will have some time for additional Q&A from you all students, what you submitted, and then that'll be all. So let's get started.
Let's do it.
All right, so Erika, if you could start, please introduce yourself. What is your profession, current employment if you have one, and training, as well as any identities that you hold.
Sure. So my name's Erika Lim. I am finishing my master's in occupational therapy at USC. So it's about a 2-year and a summer, 2+ summer program. And I'm finishing that up right now and basically studying for boards because there's a national board exam you have to take to be an official licensed occupational therapist. So hopefully I'll be done with that in January, and then I can finally apply for employment as a licensed OT. As for identities, second generation college student, but first generation master's student. So first in my family to achieve like higher education, and background, my family's Chinese by way of the Philippines. So my parents immigrated here from the Philippines. And yeah, I don't know. I'm the youngest of 3. So I think my brothers were able to make a lot of the mistakes, and I was able to sort of experiment with different occupations, which I can go into later. But I'm really happy that I found occupational therapy now. I am 32, and so I did find OT later in life. But I'm really happy to be here now.
Awesome. Yeah. People have different journeys. It's not a race. People change careers all the time. So thank you for sharing that. So on that note, what do you do? Like, why occupational therapy? Like, why?
Yeah, so a lot of people have difficulty understanding what occupational therapy is. I think that it can be really blurred, it can be very vague, but at the heart of it, it's really rehabilitating people, as well as being preventative through daily occupations. And what occupations are is what people need to do, want to do, or yeah, kind of have to do during daily life. So that can be getting dressed again, that can be like getting dressed by themselves after a serious car accident, whether that is someone that may have dementia and she misses or he misses just being able to knit again. And so it's really working on that specific occupation with them. Something that's motivating, something that they specifically care about as a means to rehabilitate through their condition, their illness, whether it be physical or mental. The best way I like to explain occupational therapy is it's the therapy of doing. So while you might say like physical therapy is a therapy of movement, or psychotherapy is the therapy of talk or thought, we do rehabilitation through doing. So doing can be very different for every single person. Like for you, Erin, it might be being a professor and teaching, organizing and figuring out how to manage your time to be able to give to every single student that needs help. For me right now, it's studying. I have a big test coming up, and so figuring out, maybe building like a daily schedule of what fits me best so that I can take care of myself mentally. For a mother, let's say two people get in the same car accident and sustain the same injuries. A physical therapist might work with them in the same exact way, but an occupational therapist will work with them very differently. And that a PT will ask or figure out how to get you to walk, and an OT will always ask you, why do you want to walk? So a person might be, they want to, they're a trumpet player and they need to go back to gigs. And so it's really working on diaphragm breathing, get dexterity in their fingers, rehabilitating them physically so that they can get to their gigs. For a mother of two that sustain the same injuries, it might be that she just wants to cook again for her kids. And so we would work with her directly on how to reform her kitchen so it's accessible to her, even despite her injuries. I know that was a long-winded way of kind of explaining OT, and I apologize, but as you can see, it just traverses physical disabilities, mental illness, kind of just across the board. It's very holistic in that way, and so that's why I chose OT, because you can really work with a diverse population.
Awesome. Thank you for explaining that. Definitely, students kind of go back and forth, like OT or PT. Sometimes they hear, oh, well, like OT is about like, you know, fine motor movements or whatever, right? But it can be about that, but it's also about what you said before, like how do you kind of make meaning and what do you do? So I like how you framed that. Thank you.
Yeah. I like to just call it like the soul of people. It's very client-centered. It's really just asking that person directly and building rapport with them directly and seeing like, what will motivate you to rehabilitate? Is it art again? Is it meditation? You know, it really, not only does OT work with physical, but it really kind of finds different alternative ways of bringing in healing. So you'll find a lot of OTs that are also yoga instructors, that might be acupressure therapists, that might be feeding therapists or hand therapists. And so it's a beautiful profession because it brings in a lot of Eastern and Western types of interventions, because it comes from a very holistic core.
That's awesome. So for the next question, you mentioned that you didn't quite find OT right away. Can you please describe your career path thus far? What jobs did you have? What schools did you go to? Any kind of detours?
Yeah. So I did my undergrad at USC and I finished in communication. And I was a bit lost coming out of that, not really knowing exactly what I wanted to do, where I wanted to go. But I did move to New York. It was like I knew I wanted to move to New York, and so I did. And in finding a job, I wasn't very picky. And a friend of mine actually got me a job in advertising. And so I worked in advertising, and I worked for really like big brands, I'd say, like Kraft and Procter & Gamble and all these really great accounts, but it just didn't feel very fulfilling in that way. It supported my lifestyle and it provided paycheck while in New York, which was amazing, and I was able to explore the city in that way because I had a job. But as far as sort of having or speaking to me in a very meaningful way, the job didn't really serve that. And so after 3 years in New York, I moved back home to LA, and I continued working in advertising again for another 3 years. And I thought that I could give it another chance because the account I was going to work on was Disney. And so I thought it would be really creative, really interesting. And it was. I was able to work on movie campaigns and, you know, the Avengers sort of series. And so it was exciting. It was exciting being able to have the experience of working and presenting in front of really large clients, like high esteemed clients. And it really built my professionalism, I think. And so it brought me a lot of wonderful tools. But again, while for others it was very meaningful to them, for a lot of my colleagues it was meaningful because, you know, I think they had a very strong relationship with Disney and the brand, and they knew that they wanted to work for that brand. For me, I didn't really have that same passion. I think that when I really took a hard look at myself, I knew that I wanted a career that at the end sort of provided a personal service. So working one-on-one with people, leveling the playing field, providing services for people that may be underserved or underrepresented. I really had to dig deep a little bit and be like, okay, what is it that you actually care about? Because, you know, you're going into the office kind of day in and day out, and you're putting in all these hours into something that doesn't feel meaningful. So at the end of the day, I knew that I had to leave after like 6.5 years of working in advertising, and knowing that it wasn't kind of the right fit. I left. And then that's when I sort of started calling a lot of friends that I felt were really, that had talked about their jobs to me, and that I found interesting, just to explore what else is out there. And so I spoke to a lot of OT friends, actually, and their stories were beautiful. One person, you know, worked in a school with kids with autism, and not only did they work with the kid on developmental milestones, like working on their handwriting or working on energy and how to kind of calm and cope during very sensory sensitive kind of experiences at school. Or maybe they would work with the kid on bullying and how they felt isolated, and kind of working on those psychosocial interventions. And then another friend worked in a hospital, working with spinal cord injury, this woman with spinal cord injury, that she just wanted to return home and kind of take a shower by herself. Like, she didn't want anyone to help her with that. And so he worked with her directly to figure out, okay, how do you be autonomous over that specifically? Because it is very personal. It's a personal task that people want to do by themselves. And so I just felt like these two people had such separate lives, but it was still under occupational therapy. And it was still, united by this understanding that it's like people first, like talking to someone like directly. It's a one-on-one relationship. And you get to kind of build that rapport and talk to them very candidly about what their needs are, without necessarily looking at a book and be like, okay, you have cerebral palsy, and so therefore you need to work on this, this, and this. It's really looking to them and be like, what do you want to work on, and how can we get you to do that, while still making sure that you feel comfortable in your everyday life. So yeah, it's been a whirlwind. It's been a lot of soul seeking. It took me a long time to get here. So I respect anyone that sort of does a second career in OT, or just in general. But I will say in OT, there's a lot of second careers, because I think there is this soul element that people don't realize that they want to work with until later on in life, because you do get distracted, and which is important, with exploring what paths to take right after undergrad, and you sort of jump on things that you think is the right path, and it is. Again, I don't regret doing advertising. I learned how to work under high stress situations, and still be calm, which I think really helped, is going to help a lot in my career in OT, because you do have to sort of, be very calm if someone's having an episode or having an emotional moment during because their whole life has sort of been kind of uprooted by their physical injury. So I think there's a lot that we learn throughout our phases and what we go through, and I regret nothing. So that's, yeah, that's sort of my path.
Awesome. Thank you for sharing. I mean, definitely, it's important to hear how maybe in the different moments in our lives, certain things motivate us over other things, but ultimately, it's wonderful that you found something that really resonated with you and really resonated with your soul. And it's beautiful hearing that. And I think it's great that, you know, there are other people pursuing OT with you that came to a similar realization that, you know, this is how I want to serve going forward.
Yeah.
So, thank you. So the next few questions are about your career. And so I know you are not officially an OT yet because you have to pass the boards, but I take it in your graduate program, you've had a lot of exposure to the field, right? Could you share what has been the best part about occupational therapy, particularly from what you've been exposed to?
Yeah. So in school, usually the curriculum is broken into the three main areas that OTs work in. So that's adult physical rehabilitation, that is mental health, and the third is in pediatrics. And so most of the time in most programs, you will go through a fieldwork placement in each of those emphasis, and you might get more than three. So three main ones, 3 level 1s, which is kind of a shorter stint, and then 2 level 2s, which is a larger stint. But of course, those differ based on program. Anyways, yeah, the best thing about it is that you, again, get to work with so many different populations, and you get to understand that life experience. I think for me, my mental health placement was a bit mind-blowing. I worked with children who had mental health issues while in school. So those could be children who've been neglected, children who experience depression, bullying, children, undocumented children that have been separated from their parents. And so it's a lot of life experiences that I may have not been gone through in my life, but opens you up to what the needs are for these specific conditions. And I think that kind of really just opens your heart into understanding, okay, where can we relate, and where can I kind of understand where I can't relate and address that and respect you for that experience, but still find ways to get you to rise into whatever's next for you, without kind of, necessarily pushing me on you. So I know it sounds a little kind of crazy, but I think the idea of just being able to hear people's stories, honor them, respect them, and then really get them to grow into their next place, and support them however they need. And usually, even though you may not have that life experience, if you build that trust and rapport and a relationship, they will be able to tell you what they need, and they will be able to allow you to support them. And so I think that was the best part of OT so far, is that not only working with people that you may not have ever kind of identified with, but still being able to serve them. I think also In my other field replacement this past summer, I worked at a hospital in Fresno working with an inpatient rehab department. So right after kind of adults that have physical disabilities, maybe car accidents, strokes, spinal cord injuries, things like that, they go into the emergency room, they go into acute, and then they come to us when they are preparing to go home. Mm-hmm. And so we are sort of the transition between them facing this huge injury and then how to be independent at home again, how to go back to their jobs. And so that, you know, is a very different kind of way of thinking than working with someone, you know, a kid that's experiencing bullying at school, but really sort of to problem solve that. And again, be able to just listen to someone's experience and then figure out ways to get them to where they need to go. So it's broad and it's not boring by any means. And I haven't heard any OT that has not been excited or happy about their job. I think that sure, they experience burnout, but what's beautiful is that if you are working with children and, you know, after 5, 6, 10 years, you're, you know, a little burnt out, you can shift. There are opportunities in the profession to shift into working with adults, working with, you know, in mental health placements and sort of changing scope a little bit, so that to kind of fulfill what you need in your personal life.
Yeah, I can definitely tell from the way that you talk about it that you're so passionate about the field, and I can tell like it has a different value system than sometimes some of the more traditional health professions that are kind of more like, okay, I'm the expert, I know what you need, versus from what you've described, it really is patient-centered. Like they have the answers, they know the way to rehabilitate themselves, but it's your responsibility to kind of guide them to that. Would that be correct?
Absolutely, yeah, you definitely got it. I think it is a dance for sure. It does break down that expert patient kind of hierarchy, and in some ways it does that sort of more equal relationship makes things more difficult, because a lot of patients do look to us and be like, what do I do? Just tell me what to do. I need the solution. I need the fix. And it can be a challenge sometimes, because it forces the relation to be like, well, let's sit and let's talk about let's try to take a step back and see, you know, I'm not going to give you the answers right away, because you're going to do this and then feel like it's not enough. And so it's really kind of coming back to you and your rehabilitation, and so that you're doing it for yourself and not for me, right? So yeah, I'm glad that you sort of got that, Erin. That there is, a kind of breaking down of a hierarchy in this healthcare system. But that's kind of what leads to the challenges also.
So that's related to my next question. What is the most challenging part? I mean, you did mention previously burnout is an issue as well. So with I guess sometimes your patients or clients are recognizing that they have to put some effort into it also, rather than just getting the answers, or burnout and, you know, maybe these other things. But what have you seen as kind of the challenging part?
I think the challenging part is a bit systematic. I think being within a healthcare model with a kind of non-traditional, kind of holistic understanding of healthcare, we are still kind of chained to funding, right? And so right now there's a big emphasis on, for a while there was an emphasis on just quantity of care and like how it's measured through through treatment and intervention and milestones and progression. And so I think that with OT, we want to measure it by quality of care, right? And so I think that that's the biggest challenge, is that a lot of times funding and insurance models will only pay by specific standards of what those kind of models are of what healing is, right? And so for us, you know, it can be very difficult, and it's a lot of jiggering and documentation a little bit, and sort of, but it's hard to sort of put us into a very strong kind of specific funding model. And so I think that was one of my biggest like hangups actually starting to work and starting to document, was realizing that this holistic understanding isn't necessarily respected right now within healthcare agencies, but in traditional models. But we are working towards that. I think that there has been a bigger shift in understanding quality of care versus quantity. I think it needs a lot more advocacy, which we're still working on. But I think the most difficult part is still implementing that soulful intervention planning with still abiding by the goals that are paid for. So does that make sense?
Yeah. So if like you mentioned previously, that if you're working with a patient and he wants to like learn how to like play his trumpet again, like maybe you have him do an activity that doesn't quite fit into a certain like ICD-10 DRG or whatever, right? Yeah. Whatever the clinical code is.
Right.
Yeah.
So it might be, you know, that you are, for that guy playing the trumpet, it might be, kind of coping mechanisms. It might be kind of hand rehabilitation, whereas like you're going to be doing so much more than that, you know, but it'll just be coded under that because it's like, that's how we get funded. And so, you might be working on so many other things, like how to rearrange his house so that he can feel like there's more space in it so he can play as loud as he wants. And I think that goes with everything, you know, most professions, where a lot of things that you do can't get coded or paid for, you know, especially it happens with school OTs where, while you are only getting paid for the time with your treatment with the child, there's so many meetings and hours speaking with the parents that you don't get paid for, right? And I can only imagine that most healthcare professions deal with the same thing.
Yeah, and I think that's really helpful for you to share that insight, because that might not necessarily be something that an undergrad, as they're thinking about these careers, that they would see that as a concern, right? In this class, we did cover like how healthcare is funded in this country versus other countries in this world. But yeah, I think it helps to hear from someone who's gone through grad school and the realities of working in the profession.
Yeah, it was more challenging than I thought. And it's interesting because a lot of OTs are going into private practice because they need to kind of be able to practice however they want, and then not sort of be bound by all the requirements of insurance policies and things like that.
So my last question with regards to career. So as a professional, how have you seen culture and language influence the care and services in your field? So we also studied in this class that demographics are changing, and you did allude to a couple of different populations. How have you seen culture play a role? so far?
Because OT is so client-centered, culture and language is vital. Hands down, you know, I did give the example that I may not relate to he or she or they, you know, and so, but I'm still able to provide care. But hands down, people like to receive healthcare from those that look like them or have their experience. Someone that, you know, you don't have to take time to build rapport, and you can actually, you know, that they know what your experience is, and, you know, you can kind of skip all that and get to the kind of the nitty gritty, and you know that they will be able to empathize with you. And so I think in this profession specifically, like, diversity is key. It, you know, an example I could think about was this past summer I worked with an older woman from India, and she was recovering from a knee replacement, and she only spoke Punjabi. And so I had to have a translator on the phone, and then she just wanted me to do everything. She wanted the nursing staff to do everything. She wanted the PTs to do everything, like, for her. She didn't really, because in her culture, like, she knows when she goes home, her children are going to take care of her. Her grandchildren are going to kind of wait on her. And so it was a bit of a challenge, you know, being that in OT school, we learn kind of Western values of self-reliance, independence, doing things on your own as you get older so that you can find value in what you're capable of doing and not your disability. And so I really had to sort of dig into my, I think, Asian American background and be like, no, I get it. You respect your elderly. You respect and honor your elderly. I would do the same thing for my grandparents. How do we form and use that to kind of empower this relationship? And so, while still meeting goals for funding, right? So it's lots of conflicts that happen, but culture goes into this because, you know, I really had to take my background in honoring my grandparents to transfer that into this relationship. And I respected her and listened to her. And, you know, when she had like a request, I would do everything I could to grant that, just like I would my grandmother. And then, but I also sort of made sure to, while building that rapport and that trust with her, and knowing that, like, I have that shared experience and that I want to treat her like my grandmother. Once I sort of built that foundation with her, I was able to kind of finally, like, empower her to do things on her own. And it really was just about building that trust and having that kind of cultural connection, for her to know, oh yeah, okay, she respects me. She knows that I'm older than her. She's not going to boss me around like a lot of the staff do because, you know, they just want me to do something. That she knows that there is a respect that needs to happen in this relationship before I'm going to do anything for her. And so at the end of it, you know, we had a really great, she started bathing by herself and toileting by herself and doing all the things that she initially did not want to do by herself and wanted me to do. And so it was kind of, it was very empowering on both sides. But yeah, culture was very important in that. If I did not have that understanding of what family is and this sort of hierarchical and respectful structure, and if I couldn't empathize with that with my own grandmother, like there would have been a huge disconnection. It would have been a harder treatment session. I think the therapist would have given up a lot faster. And so, yeah, I think wherever you come from, this profession will allow your experience to shine on your patients and your clients, because it is about relating, and it is about honing into like who they are as people and what their cultural experiences and their background, in order to build connection, and build and promote healing.
That's beautiful. Like, I think it's clear that, you know, when you can find a way to relate to them, and again, like, it's not that you were exactly the same kind of ethnic background or anything like that, but there were some shared values and you were kind of able to see that, and that enabled you to, you know, do your work, right? I think sometimes when people think about cultural competency, it's about like, okay, let me memorize a bunch of different stereotypes, right? But that's not what it should be about, right? It's about how can you relate to this other person and see what their values are, and I love that you have the success story of how you were both able to be empowered after it. That's really awesome.
Yeah. And it took a while, you know. It wasn't like, oh yeah, I'm gonna respect you and we're gonna build this. It's like it took maybe at least a week to just like talk through things, for her to sort of warm up to who I am. I like braided her hair every day because it was important to her, and her granddaughter does that for her. And he's like, yeah, I'm cool with braiding your hair. Let's do it. Like, you put in that work so that you can feel trusted, and that, well, it's not you just feel trusted, but that your client can actually trust that you are there for them. And that you're not going to push treatment on them if they're not ready yet, but prepare them to be ready, you know, instead of just pushing treatment right away.
Yeah. And that probably relates back to what you were saying about, okay, so how do you charge braiding her hair, right?
Exactly. Yeah, there was no way I could charge braiding her hair, but did I like talk to her about what her options are for what kind of tools that she can use, like what kind of equipment she can use in the bathroom? Yeah. So, you know, you kind of like get creative on how you build treatment in. But yeah, it was a lot of hair braiding so that she can trust me. And there was some like, okay, let me talk to your son about what the bathroom configuration is like, because I do need to build something, you know. And then, and you make it work.
That's awesome. So hopefully by now students have realized that there are different paths to get to occupational therapy. By using an example, they also should have read in the textbook the different educational requirements. But what advice would you give to an undergrad, again, knowing that you didn't know you wanted to do this until after undergrad, but what advice would you give to someone who's in college right now, wants to do what you do?
I would say take time to explore the field. So whether that's reaching out to different facilities that have OTs to see if you could shadow, or even just an information interview, like talk to them, email them, see whatever questions you have, see what just be curious. That's kind of the biggest thing. OT is a beautiful field, but it's wide and it's vast. And so you never know what will kind of strike your interest, and you never know what kind of population you want to work with. And so I think because OTs work in so many different kind of placements and settings, ask them about their experience. I think that's the best thing you can do, is because they will give you kind of real life examples of, again, kind of soul stories, but also challenges and the real kind of the real deal. And it's good to have a breadth of understanding because it's such a deep and wide field. What else? I would say also explore the different programs. Each program is very different. Some programs are a little bit more kind of physical disability based, so you'll take a lot more anatomy, kinesiology, things like that, physiology, and that's going to be a lot of the center and core of it. other programs might be more honed and prized for pediatrics specifically. And so I think exploring the programs, going to take tours of the programs at the facilities to see what's a right fit for you. Because what I've learned from a lot of different students and graduates that I've spoken to is that each program has a different kind of emphasis. For USC specifically, there is a really big one, they tout their advancements in pediatrics, but also it's really leadership. I would say it's the biggest kind of thing that they're really good at. They allow you to build your own kind of way through the program. There's a lot of flexibility in that, like, if you knew you wanted to go into this specific area, you can start pretty early on like building that for yourself. There is a lot of opportunities just for leadership in that way. In I don't know, going a lot of sponsorships to go, or scholarships, I'm sorry, to go to a lot of leadership conventions, things like that, to see what's kind of innovative in the field. Again, it's more money. It's really, also that's a big thing, is like understanding what you can afford in the different programs, because some programs are a lot more expensive than the others. And so it's being honest about that, and seeing, what schools give scholarships, because as much as USC is expensive, they also give a lot of scholarship. So doing the research, I'd say, do the work and do the research, and find the right place for you.
Awesome. Thank you. Yeah, it sounds like a lot of it is about fit, right? And so maybe there are some standard things that are the same, of maybe certain prerequisite classes or, whatnot, but really finding like what is the fit that's gonna work for you, right? Awesome. So with that, I wanted to end on a question from a student.
Sure.
So this student asked, and you did touch on this, so feel free to elaborate. How was it like to work for Disney's advertising department? Also, what made you want to leave a position with a prestigious and globally known brand? I understand you prefer a service-oriented and client-centered position, but I feel like you will have a widespread and mass reach with Disney's voice if you get a chance to promote your agenda.
Sure. That's a great question. You're not the first to ask me that. Working for Disney again, like, it was a wonderful experience. It created a huge toolbox for me in what I'm able and capable of doing under high stress situations. The brand, it's a big brand. I think that the issue there was that I felt like a tiny, tiny voice in this huge brand. As I felt like I put in a lot of real great creative work into building a lot of the advertising campaigns around the films there. But, it was maybe 10, 15% of those ideas really kind of went to fruition. If that. And so, very bluntly, I guess, I feel like I needed to find the right audience for my creative voice. I think Disney was not that. I don't think I needed, I wanted that one-on-one interaction, because I wanted that, my talents and my skills and my strengths to benefit more people in a deeper way. So I think that with Disney, it was like I was a little voice, but decimated to everyone. I think I wanted to be a louder voice for, a smaller number of people, but like in a more quality way. So I hope that makes sense. It was a change of career, and there was a lot of tout and prestige and working for that brand, but it really took a mirror to myself to see what I really wanted to value in my life and what I wanted to use my voice for.
Thank you for sharing that. I think it's nice how you were still able to use your creativity, right? But in a different way, right? I think a lot of times people think, okay, I'm a creative person. What should I do? Okay, advertising, you get to use your creativity. But in OT, from what you've shared, you are constantly being creative. Like what solution can you find along with the patient or client to solve this issue, right? Or to help them reach their goals. And so I think that's a great way to use the skills that you had been developing, right, in your career, but as you said, you know, finding a different audience for that.
Mm-hmm.
So.
Yeah.
Awesome. Well, thank you very much. It has been so wonderful talking with you. I truly appreciate it. And I wish you all the best with your boards.
Thank you. Thanks, Erin. And if any students have any questions, follow-up questions, like feel free to get my contact information or give out my contact information. And they can reach out to me directly.
Awesome. They have your email address.
Perfect. Beautiful. Reach out if you have any more questions then.